Hello, and a huge welcome. Thank you so much for joining us. My name is Brianna Greer, Program Coordinator here at Hybrid Solutions. And today's webinar topic, Stress Reduction Strategies for Practice Staff. Who are we, you might ask? We are Georgia's Health IT Center, assisting clinicians in our state with promoting interoperability efforts through the successful use of EHR systems. Highbridge collaborates with our partners and community to provide this assistance. Highbridge is located at Morehouse School of Medicine, National Center for Primary Care in Atlanta, Georgia. Carmen Hughes is our Executive Director, and Dominic Mack is our Executive Medical Director. Today's webinar is brought to you by our program managers and moderators, Phoebe Nelms and Selena Williams. We are so very excited to introduce our panelists for today. First, we have Dr. Tori Prothero-Wiley. Dr. Tori has 12 years experience in public health research and counseling, and she also serves as a therapist life coach for individual groups, couples, executive communication here in Atlanta, Georgia. Today, we also have Donna Edwards, practice manager for Surgical Associates of Metro Atlanta, with 20 years of experience in practice management and counseling. Thank you so much, ladies, for joining us. Our objectives for today are to define challenges introduced to practices by COVID-19, review strategies to maintain staff morale and build coping skills, and also to identify available resources. Thank you so much, and I will turn it over to Selena Williams.
Thank you so much, Brianna. Good day, everyone. I would like to personally thank each of you for taking the time out of your busy day to join us for a short Q&A on how COVID-19 has affected your organization. So, hi, Donna. I'm going to start with you. You have been a practice manager for over 20 years, managing the day-to-day operations. You're also a medical consultant for several independent physicians' practices in the Conyers and Covington area. So tell us, overall, how has COVID-19 impacted your staff and clinicians mentally and physically?
Well, unfortunately, being a surgery practice, it took a great toll on us, particularly because they just about shut us down when they told us that we could no longer do elective surgeries. So we took a huge financial hit. Some weeks it was down as much as 95%. We were not allowed to do anything. We are also a bariatric or a weight loss surgeon. Dr. Maynard does general, and then he does weight loss surgery, and those are nothing but elective procedures. So we had all these people in a program, and they were just devastated. And they brought a lot of that frustration to my staff. And it's a very emotional time for the staff because we feel like we had just totally let them down. I think Selena will tell you that my practice is a very family-oriented type practice because we do know with being weight loss surgery that sometimes we're the last resort for people who feel like they've been told if they don't do something, they're going to die. And all of a sudden, with not being able to do their procedure, and some people, that was their last, they're finishing up. It was time for their surgery. And they would call us crying more. It was just devastating for us. And, the staff was like, I don't want to answer the phone. I don't want to talk to this person. Can I just let the phone catch it? And we were dealing more with that more so than, do I have a job tomorrow? Or am I going to get paid this week? That was the hardest part, I think, for all of us, is knowing those people that were counting on that procedure because they had been told, whether it was from their primary care or a cardiologist, or if you don't get your diabetes under control, or you don't do this or you don't do that, you might not be here next year to say, I'm sorry, we can't do your procedure. We don't know when we're going to be able to do your procedure. It's heartbreaking. I mean, it was and to have them cry on the phone to you, and they would say, can we come in and talk to you? No, because being with a Piedmont clinic provider, they didn't want them in our office. And I think we came home more brokenhearted over that than even being concerned, or we're going to get paid. That was very, very difficult for all of us. We worried about our general surgery patients, but you hadn't established a relationship with them, so you didn't know about them. You didn't know about the appendectomy, so you didn't worry about it per se. But these others, it's been extremely difficult.
Thank you so much, Donna. And that kind of leads into my next question. I know some of the patients that hadn't been in, but what about the patients that were seen for follow-up? Did you guys utilize telemedicine at all? And if so, how did that benefit or not benefit your practice?
Well, it was very beneficial to us because the few patients that we did do surgeries on, that would come through the ED, because that's the only way we were generating patients was through the ED when he would be on call. We did that. The only patients that we brought into our practice were the ones that he absolutely had to see, that maybe had staples that needed to be removed. Dr. Manor does a lot of robotic procedures, and so he wasn't necessarily to see them, so he could do telemedicine visits. So that was great. And it's in fact something that we're hoping to be able to incorporate further down the line and just continue to do that. Telemedicine is not a great payer. Of course, you don't get paid anyway post-procedure. But, it's really been nice, and people have appreciated that because they don't want to come back in. They already feel better, so they don't want to come in. So we had a great opportunity to reach back out and see how they were really doing and not inconvenience them for those that had been able to return to work. So, I think it's a great opportunity to show we cared about, hey, you're already back at work, but can we see how you're doing? So I think it was a nice reach out touch to people.
Well, that's great. That's great that you were able to utilize that to a certain extent. So how do you think we can use the lessons learned during this pandemic to strengthen healthcare and support clinicians' health and well-being?
I don't think we have ever fully supported our clinicians and our physicians in the past. I don't think society truly knows what physicians go through. I think we've always been under the mentality of they make so much money that society has always helped them buy a very expensive car and put swimming pools in their backyards and help them live in a big mansion. And we all know that's not the case, that insurance does not reimburse that. We know that, but I don't think society knows that. I think society thinks that these are people that make millions and millions and millions of dollars. Selena, you've been in my situation. You know they don't make that money.
Yeah.
You know what insurance reimburses. And I think for maybe once in my career, I think people are starting to see that doctors work very hard, clinicians, nurses, whatever, work long, hard hours, and they're just as susceptible of catching a virus, an illness, a disease, as you and I are. I think they always thought that they didn't catch these things, that they were immune to them. And I think it's a great opportunity to just see that these type of people, these heroes, are just normal people. And they can get sick, and they can die, and they can be tired, and they can be scared, and they can be lonely, just like you and I can be. And I don't think society's ever thought about that. I think they expect them to be there 24 hours a day, 7 days a week, and they've never considered that they had a family, that they should go on vacation, that they should have a life, that they got kids. I think they just thought, no. I look at it kind of like they do a preacher or a minister. You're not supposed to have a family. You're supposed to be there when I want you. You're supposed to be there when I need you. So hopefully we've learned that these are human beings. These are normal people, and they need to be treated that way. Whether that's going to happen, who knows? This might blow over, and heaven forbid, 10 years from now we'll be in the same situation, and we won't have learned a thing. I hope not. I'll be retired, and I won't know. But I would hope that we have learned to appreciate healthcare providers and clinicians and nurses and anybody that works in healthcare. I don't care if it's the ones that are sweeping the floor, that they have the hardest job of all, because they're there when we're not there, 24 hours
Right.
a day, 7 days a week.
Well, Donna, I thank you so much again for taking the time to participate. Do you have any helpful tips that you can provide during this time to any practice managers or physicians, administrative staff, nurses that will help them get through this pandemic crisis?
You know, I think the biggest thing is you got to continue to educate and be patient while you're educating, because I learned this a long time ago. If you always kindly treat everybody on a 5th grade level, not rudely, not disrespectfully, but kindly treat them on a 5th grade level as you educate them, you'll get a lot further. And I mean that in the sense that if they don't come in with their mask, don't be abrupt, don't be ugly. Just say, we really need you to put your mask on, cover your nose, cover your mouth, for you as much as it's for me, instead of just going off the deep end with them, which I want to do because we've been told and we've been asked and we've pleaded. If you kind of just treat them on that level and educate them in a kind and gentle way, maybe they'll get it. So I try to tell my staff, yeah, you want to beat them around the head, but I do the same thing about collecting a bill. Gently remind them, don't beat them over the head. Sometimes that old saying, you get more with honey than you do with vinegar. And it's hard to do. And it's even harder in this type situation. But everybody's hurting too. Mm-hmm. Everybody else is hurting too. And you don't know what that person that you're speaking with what situation they just walked out of. And that's what you got to remember. What phone call did they just hang up from? What letter did they just open? What situation did they just walk out of? That's what I try to tell them when they're having to deal with a patient or a customer or whoever walks in their presence, whether it's me or one of my nurses or whether it's one of my MAs or whether it's my receptionist. Just treat them with kindness. Kind of get to their level. You get a lot further, particularly now.
And I guess the same goes with across the board staff interactions too.
And even your doctor.
Even your doctor.
Even your doctor. Because you don't know that he didn't just walk in from losing someone.
That's right.
Absolutely.
He might not have had a chance to tell you what just happened in that OR that he just walked in from. And I have to remember that too before I wanted to say, I got 45 charts I need done right now.
Oh, I can relate to that, Donna.
I did that for you. This is an ongoing discussion for us.
Yes.
But you just don't know. So
Thank you so much. That's
so
real
much.
talk, as they say. That is real talk. We so appreciate you sharing, the realities of the situation and how it's impacted your practice. So,
Thank you for having me.
yeah. So now we'll turn our attention to another healthcare professional who actually is an expert in coping with stress and life's anxieties and pressures. So Dr. Torrey, I'd like to ask you the same questions. Overall, how has COVID-19 impacted you as a clinician and maybe other staff members that you work with mentally and physically?
Oh, well, first of all, thank you for having me. This pandemic has, I think, more than anything, shown us how resilient we are. Because when it first hit, I think everybody was in a little bit of denial about how long it was going to last. Was it going to be a vaccine? Was it actually going to hit the United States like it hit Italy? And I think when we got the reality that, okay, this is real, and some of us still don't believe it's real, but I think overall, when that came into our work environment, because even in one of my offices, half the staff would wear masks, half the staff wouldn't. And the clinical director had to kind of come in and say, look, the state is reopening, we need to do these things. I think we had to learn to go from an individual mindset to a collective mindset. And I think for most people, that's very hard because we as Americans are very entitled and we can be very spoiled. And so we think that it's about me, it's about me. But in healthcare, ultimately, the goal is about the patient or the client. And so, you know, to have the total volume in one practice, in both my practices, really go from everything being face-to-face to now virtual. And so even though I already had a virtual clientele, the switch wasn't that great for me. I just shifted gears and my clients didn't want to come in. And to be honest, I didn't want to come in. So it worked great. But in my downtown Decatur office, where I am in a practice with other, practitioners, it was different because the clinical director and the head of that office wanted, of course, everyone to keep coming in. He wanted to keep the same type of economics flowing through the business, so to speak. But when he realized people are really afraid, and when he realized that the numbers were still going up, then eventually the staff kind of shifted and people started all wearing masks coming to work. Now, for me, I had to put my foot down. I was like, yeah, I will come in, but I will work virtually from the office. So I'm still not going to see clients face to face right now because I don't feel comfortable. And to be honest, my clients don't want to come face to face. And so we had to have an agreement of that. There was a lot of staff that was like emphatically, no, we're not coming in. We're going to work from home virtually. So probably around the months of May, maybe June, there was kind of a rift in the office because some people were willing to come in, some people weren't. And, people have opinions. So people are saying how they feel about it instead of just being respectful, like Donna was saying about, you don't understand people's situations. Some people have elderly parents staying at home with them. Some people have small children that have health issues. Some people themselves have health issues unbeknownst to you. So if they don't want to come in, their health is, the most important thing. So I just saw people really trying to learn to go from thinking individually to collectively. That's what I saw more than anything.
Right, and then all the emotional impacts on that.
Absolutely.
That's a good point. So how do you think we can use the lessons that we've learned during this pandemic to really strengthen healthcare and support clinicians' health and well-being? The reason that comes up as part of our subject at all is because the Department of Health and Human Services is really focused on everything that kind of drives what they do and the incentive programs and everything like that. Really wants to hit not just the triple aim, access, cost, and quality, improving the quality of healthcare, but also they recognize that we really need to start paying attention to the joy and work of our clinician burnout, things like that, because the suicide rate for clinicians is appalling.
And the alcoholism rate.
I hadn't even thought about that. So that's why it comes under sort of our umbrella. We want to use health information technology to support clinicians, but we realized during this time that there's something that technology just isn't touching, and it's this topic that we're talking about. So this is just another way that we can try to support. So what do you think we can do moving forward?
Well, moving forward is interesting. It's not mandated for licensure, but I do think clinicians need therapists themselves. I think it needs to be more training around how therapists themselves get help. Okay. And now that we do have a virtual platform, which I'm hoping will only become better, more sophisticated, because the telehealth has helped greatly as far as working the hours you want to work. being able to schedule things maybe later in the evening or maybe even earlier to address the client and the patient's needs. I mean, the provider and the patient's needs, as well as just kind of mandating something like we have to have a certain amount of hours to keep licensure, but I think it should be something also kind of driven into how much help we get. Because if you're going from seeing, I'll give myself an example. I was seeing somewhere between 5 and 6 clients a day. Now I'm seeing close to 8 a day, 6 days a week I'm working. Now I don't see 8 clients on Saturdays. I see maybe 3 or 4, but still, that need in a clinician to help and to be available, I think is also playing greatly into the burnout. The burnout comes from, I got to be available, I got to be available, I got to be available. The other thing that needs to happen too is an incentive to change insurance platforms, because there should be better pay. There should be. I'm sorry. I mean, people are paying exorbitant amounts of insurance, and behavioral health sometimes is either more expensive in how
or not covered.
Or not covered. Thank you. And so I think, having something where maybe telehealth is taken care of in another way. I thought it was fabulous that all of telehealth was paid for by insurance providers the months of April, May, and June, I think it was. No.
And they have proposed to extend it permanently.
Right. And so those type of things need to happen so that people know that they can get coverage and be seen. But on the flip side, there needs to be some provisions for the provider, because it's kind of like, a kid in a candy store. You go, oh my God, I can make all this money. I can work all these hours, which is great as a provider. But then to factor in what that entails, as far as note taking, as far as hours being available, as far as the way that they set up the actual billing codes, there should be 30-minute sessions as opposed to just 45-minute and an hour session. They need to tweak some of those things, because some people, to be quite honest, after you've gotten past a crisis place, they don't need an hour of therapy. They might just do well with a 30-minute maintenance, but still need that maintenance depending on the diagnosis that they have. So those type of things need to come into suit, as well as, looking at a clinician from a standpoint of, okay, maybe there is a mandate that comes that says you can only work this many hours if you're under a particular provider. Like, clinicians can only work under Blue Cross Blue Shield 30 hours a week or 25 hours, something that there can be a cutoff as well, specifically if you're starting to know that you're reaching burnout. So there are minor things that probably need to be looked at, from the economics behind it to the actual coverage, the billing, and then, like I say, making sure that clinicians are actually getting the help that they need as well.
Yeah. Superman, Wonder Woman, they all have vulnerabilities. So sometimes your greatest point, that desire to serve and help and be there, it turns out being the Achilles heel that, jeopardizes their own well-being. And so those are really good things to think about. I appreciate you sharing.
I think if they mandated it, it would take that stigma away from it. Because, they don't want to admit anything, because, they are Superman. So if they mandated it, then it kind of takes that stigma away from it. I got to do it, because they do need it. They do need it.
And I would be very transparent. There are times when that's a service I'm not utilizing myself. And I have people that I can talk to, but it is a huge difference to talking to a loved one or family member, even a colleague, as to going to your own appointment and sitting down and knowing this is my time to be taken care of. This is my time for somebody that's not going to pass judgment, that's going to offer me solutions, that's going to offer me coping mechanisms to help me get to the next place. Mm-hmm.
Well, it's on every credentialing application. Do you think they're going to check yes? Please.
Yeah.
Please.
Absolutely.
So stigma impacts clinicians as well when it comes to taking care of your emotional and mental health needs.
Yes.
Wow. Okay.
Absolutely. I would say so.
I agree. I think that it's kind of an unspoken thing where I think, some clinicians go, oh, I don't need to say that. Yeah, you do. Yeah, you do. We all do. Because I see us as sponges, and we are constantly absorbing all kind of energy, and we need to know how to facilitate that energy, how to dump it, how to get rid of it. Yeah.
Well, you got to remember,
Beautiful.
so many things are tied to malpractice and things like that. They
Mhm.
all, that monetarily,
Very true.
they're always thinking about those things.
Yeah. Very true.
You know, they pay astronomical malpractice.
Very
You got to think about that. And if anything is tied to that, they're going to pull back.
Oh, good point. Good point. It's like they're between a rock and a hard place on that issue, huh?
Mhm.
And
Wow.
with COVID, I'm fearful of malpractice.
Yes. Because we don't know what it's going to look like, do we? We don't know how that's going to come down the pipeline eventually. But you know, at some point, it's going to be somebody goes, oh, I can sue for that. And then the ball is running. The ball is rolling. Yeah.
And I'm afraid, you know,
Yeah.
I got a negative test and it should have been positive, or I got a positive and they did all this stuff to me and now they're saying it was negative. Hey.
Yeah, I agree.
Don't even want to think about that. So what strategies have been most useful in reducing burnout in clinicians and their staff? I perused the AMA website and they had a whole webpage with some helpful hints, but what have you found to be
Well, I've
practical?
always been a huge proponent of mindfulness practices because mindfulness practices basically assert that instead of trying to get rid of the negative thoughts, you learn to basically process them and let them flow on themselves. And even as clinicians, we have those moments when we get stuck, we get tired. Again, transparency. I'm going out of town next week because I had my moment. My moment was about 4 weeks ago. My husband's like, you need a break. And so, and I was doing everything. I was exercising. I was getting plenty of sleep. I was, making sure that I was eating in between my sessions and getting up and walking and moving and doing all the things that I suggest to clients and to other practitioners. But we all have that moment, that place where we're like, okay, this is just too much. It's time to stop. It's time to slow down. So mindfulness practices teaches you how to breathe, how to be in the moment, how to let go. A lot of times as a clinician, you may not be actually in a session, but your mind is still at work. You're with your family, or in the grocery store shopping, and you're either getting texts or phone calls, or you're remembering things that you didn't do. And so learning to actually implement breath work and, I practice gratitude at night. When my mind wants to get cluttered with what went wrong in the day, using mindfulness practices, I will practice gratitude at night. I will practice things that help me to breathe more deeply. I will sometimes do my yoga before going to bed. Those type of things help to clear the mind. And I think that's what is impacting us the most is our minds are like doing double time now on the what ifs. Somebody's
The uncertainty.
I just got off of a session prior to coming into this program. My client just found out her 90-year-old mother has COVID in a nursing home. And that is taking suit over every other part of her day. Of course it is. You get that type of information. And now it's like, how do I deal with this? How do I work with this? So I think it's important that we learn how to let the mind do what it does, but to not feel the need to respond to it, to not feel the need, I've got to do something. No, my mind is doing what it always does. It's talking to me. And now I need to cipher through and understand what's important, what's not, and just be at ease. And I don't think Americans really know how to be at ease. We're always stimulated with IG, Facebook, Twitter, Black Lives Matter.
So if I'm hearing you, you say we have to find a way to unplug, disconnect, and be and center our minds on just
being in the moment. Sometimes it's very important to sit on your deck that you paid for and watch the birds and listen to the leaves drop. It's very important to walk in the neighborhood that you're paying to live in and to see what's going on, the new developments in the neighborhood, or to see the different stars at night. It's important to do those things. And I think that we're so glued to this that we're constantly stimulated.
We're so busy wanting to see what
everybody
everybody's
doing.
We're
Yeah, I think we all can relate to that.
Exactly. We're so busy focused on what somebody else is doing rather than focusing on what we need to be doing for ourselves.
I mean, and you don't have to know what your family's doing. You got to know what you are
doing. Yes. Right. Absolutely.
Excellent point. It seems as if you answered my last question with that statement as well. What helpful tips can you provide during this time? Basically, if I was going to sum up what I heard from both of you, it would be that we need to cultivate empathy for our fellow workers and our patients and our doctors. Treat everyone with respect and kindness. Notice the ways in which you are being resilient and commend yourself for that resilience. Have a collective mindset. Think of us as a human family, not just me. Remember that sometimes our greatest point, our strength, is also our Achilles heel, our weakness. So if you know what your greatest strength is, it gives you a clue as to what you need to watch out for, what might take you out and make you more susceptible to burnout. And then implementing mindfulness practices that help you really focus on what's really important. How can I take care of myself, at least for a few minutes every day? Just calming the mind and focusing on what you can control and not what all the stimulus tells you is going on around you. And then being focused on gratitude. We're grateful each day that we are well and that we can serve our community and that we can be a light to someone. If we notice they're burning out or having extraordinary challenges that day, trying to be supportive as we can. We may not be a professional, but we can be a friend. If I had to sum up, that's what I would throw out there.
Can I add one thing to that too, Phoebe?
Absolutely.
One thing I share with my clients a lot of people are still very afraid to leave home or to get outside of their four walls. And one of the things I suggest is, if not once a week, at least every 10 days, go somewhere out, like pick a park, pick a hiking trail, something to get you out of, because a lot of my single clients I worry greatly for because they're not getting any interaction, especially if they're working virtually. And so to be able to enjoy God's nature, I think is so important. You know, a bike ride, a hike, go and have a picnic far out somewhere, pick a park 2 hours away and just make a day of it, but get out of your home a little bit.
And it doesn't have to be with other people.
Exactly. It doesn't. It doesn't have to be around other people.
You're not talking about interaction. You're talking about being outside, you don't have to interact with someone. Interact with nature and yourself.
Yes.
Not within those four walls.
Yes.
That's right. And I started that in the beginning, Donna.
Do what?
I started that in the beginning of this process. You know, each and every day I was going out to walk for at least an hour just to get away, just to get peace within myself. And then I stopped and I went into this mode where I stopped it. Now I'm trying to get back into that mode where I get out and try to at least walk or exercise, at least for 30 to 45 minutes a day.
Absolutely.
It's therapeutic.
Tell my elderly parents that. I said, when they said don't be around people, they didn't mean you couldn't go outside. You live in a big yard. Nobody has to see you. Selena knows that. I said, they weren't even getting their mail. I said,
wow.
The germ is not in your yard by your rose bush. I promise you. You know, I said, move outside, get in the sunshine. You got to connect with the yard, connect with the tree, connect with the bush, and Mom was like, oh, we've been sitting on the front porch. She said, it's the best thing. And I thought to myself, I'm just trying to be nice. I thought it's been there all along. Right. But, it came out, don't leave your house. Stay home. Don't leave
your house.
I guess
that's an opportunity for education, each of us, the people that we know that maybe have taken the directives that literally and restrictively.
And unfortunately, some of our elderly have done that. When it said, you don't need to leave your house.
Yeah.
Well, this has been one of the most enjoyable webinars I have ever done. I want to thank each of you so very much for the priceless contribution that you have made. And we just hope if one clinician or office manager or staff member benefits from the information that you guys have so lovingly shared, then it will have been so well worth it. And we want to wish each and every one of you continued success and health. And thank you so very much for sharing everything you've shared with us today. We really, really appreciate you.
Thank you.
And if there's any way we can support you all in any way, just please reach out to us here at High Bridge. Any way we can support you. I really appreciate you taking the time to join us today.
Thank you. Thank you. Y'all have a good
So
evening.
we'll turn it back over to, thank you. Okay. So this here's a few resources that we will share with the providers. This will go out as a blast to our provider community, and hopefully this information will be helpful to them to deal with some of the challenges they've been going through. So again, we thank you.
The information you guys provided today was so valuable, and I learned so much from you all, and I'm sure our audience definitely benefited and learned so much from you guys, and I want to say thank you because I really thoroughly enjoyed listening to both of you ladies, so thank you so much. It was such an awesome and engaging conversation. Moving forward, Hybrid Solutions is excited to be in partnership with these amazing organizations. This is how we do the work that we do, to fulfill all of your technical assistance, outreach, and educational needs. And our feature for this webinar is none other than 4Med Plus. 4Med Plus is an online continuing education platform designed to meet the needs of busy healthcare industry professionals, providing its members with discounted training, continuing education, and professional development opportunities. Training is approved for RNs, LPNs, physicians, PAs, clinical providers, consultants, managers, technology professionals, veterinarians, and others. Please visit www.4medtrainingcenter.com/hybrid solutions for more information. And please use our code HYBRIDGE20 to receive 20% off of your training. We want to extend a huge thank you, not only to our panelists, but also to our viewers. We appreciate you so much for taking the time to be a part of our webinar. Please be reminded that our webinars are monthly, every third Tuesday of each month from 12 p.m. to 1 p.m. Thank you so much, and have a wonderful afternoon.